Hi, everyone. It's a little strange because I feel like I'm just talking to myself, well, also to Harley, but my name is Bill Resh. I'm an associate professor at the Price School of Public Policy here at USC, and today I'm going to share with you some recent research that I've been involved with several different researchers, and I'll give a shout out to them as we proceed. This is a short talk on the effects of mixed institutional messaging during the current crisis that we're all facing. I'm facing it from my bedroom currently. You can't tell that from the background, but my name is Bill Resh. Again, I'm an associate professor from the Price School of Public Policy. And I'm going to present three different works that I've been involved with, two researchers from different universities and also a doctoral student here at the Price School. Again, I'll introduce them as I go forward with the presentation. But for a quick introduction of myself and really more about my research agenda, my general research is focused on what ways political environments and executive interventions, political executive interventions, affect policy implementation, affect behavior within the civil service, generally speaking, and also the behavior of citizens in their interaction with the state. I have a book that was published a couple of years ago called Rethinking the Administrative Presidency that looks at some of these topics, and the research you'll see today is aligned with some of that, some of the points made from that book, but more generally in terms of how the president in particular, but other political executives, their messaging may conflict with that of the professional civil service that has the expertise to deal with some of the issues that we're facing currently, and what the effect of that conflict in terms of messaging might have on your everyday citizen and also on your frontline public servants, those that are really responsible for helping us through this crisis. So with that, to this end, I'm quite interested in the effects of the misalignment between the president and the civil service institutions that are primarily responsible for providing public service or public health awareness and insights for all of us in terms of protecting the public during this crisis. We really find persistent disagreement between what the president says and what CDC, for instance, says about the best direction that we can basically put ourselves in terms of policy for this crisis. So today's talk, generally called Mixed Institutional Messaging, is going to have three different objectives based off of three separate pieces of research that I've recently been involved with. The setting, of course, is our COVID-19 crisis in the United States. The first objective is to test the effect of the president's persistent conflict with expert opinion, particularly in the federal civil service, on topics of uncertainty during the COVID-19 crisis. And what we're asking in this research is, how do citizens update their priors? That is, how they thought about things prior to exposure to information proffered by either the president or by institutions such as the CDC on topics of great uncertainty as we go through this crisis. Also, we're interested in what about when that exposure is countered by added exposure. That is, the president can say one thing, and if all we're exposed to is the president's information or the president's position on a given piece of information or a point of uncertainty within this, what happens when that's countered by added exposure, particularly by the CDC's position on the same topic? As well, on the second piece, we'll be examining the concept of branding during this crisis. Specifically, we are going to examine how the Trump administration's attempts at including Trump's name in various communications to the public are effective or ineffective in promoting his reelection hopes. We've never really seen a president such as Trump, someone whose commercial brand has been so intrinsically linked to his political brand, or one that's been as prominent in his life as a private citizen before becoming president. In the third piece, we will talk about this, or I'm sorry, in the second piece, we'll test President Trump's implicit brand equity during the crisis. The Trump brand has a long legacy, as I've said, in both the private sector and in politics. And so in this second piece, we're going to test the extent to which the Trump administration's use of Trump's name in public service announcements is associated with how citizens approve of his job during the crisis. And finally, we're going to touch on some very recent research that's still in process, which examines the day-to-day stresses of those public servants on the front line of this crisis. Namely, we follow over 200 local government workers over a period of 3 weeks in April and into May, who are responsible for delivering public services, responsible for providing first response and public health awareness, and enforcing the stay-at-home and social distancing provisions most of us are living under currently. And so first, we'll, in that third piece, we'll try to understand how that mixed institutional messaging that I was talking about during the crisis at both the national and state level can affect frontline workers at the local level. And so in that third piece, what we do is a diary method approach. We followed over 200 local government employees who filled out daily journals for us for 3 weeks. This was from April 13th to April 30th. In the midst of the crisis, we're still conducting exit interviews with these subjects, and it provides us some real-time insights on the stresses that mixed institutional messaging can cause. Also, as well as the emotional labor that public servants employ when they're engaging with the public in these times of uncertainty during this crisis. So getting back to the first piece of research. So now I'm going to give you the findings as opposed to the questions. So the first piece is collaboration between myself and Tima Moldagaziev, who's an associate professor of public policy at Penn State University, and John Marvel, who is also an associate professor of public policy and public management at George Mason University. And this piece is called Mixed Institutional Messages and Bayesian Updating Under Uncertainty. So Bayesian updating is just a fancy word dedicated to a social scientist with the last name of Bayes, who said that, you know, people have priors when they enter into situations, and they update those priors when they're exposed to a given piece of information. And what we want to see is, based off of the trust in particular institutions, right? How does that updating translate? That is, when they're exposed to different political or institutional actors, does the trust that they have in those given actors lead to updates that align based off of the trust that they had with those actors going into that relationship or into that exchange of information? So trust really is the foundation of any successful relationship, but in particular, it's important in the relationship between government and the governed. And during a pandemic like this one, it's not really an abstract matter. Trust requires an assessment of the trustees, that is the citizens' integrity, competence, and beneficence. But perhaps more importantly, it requires an assessment of the extent to which the truster, that is, I'm sorry, the truster being the voters, the trustee being those institutions, right? But most importantly, it requires that assessment of the extent to which the truster, that is the voters, perceive that their interests are encapsulated in the actions of the trustee, that is the government. There's a wonderful book on this by Russell Harton, a political theorist at NYU. And so, in other words, in a highly polarized political environment, it's likely that encapsulated interests, that is, the extent to which my interest is encapsulated in a politician or a given institution, is really correlated with my partisan identification. And I think generally, the trust in government on COVID-19 has proven that for the most part, Americans trust government. They trust government in handling COVID-19. However, when you disaggregate that trust to particular political actors and particular institutions, then we find that that trust is a bit varied. For instance, Americans overwhelmingly trust the CDC in terms of its response and its advice on COVID-19. Polls that have been conducted over the past couple months consistently show that Americans across the aisle, that is across both parties and even independents, mostly trust the CDC in terms of sharing accurate information about the pandemic and policies to address that. Whereas many Americans don't trust our president on COVID-19. Over the same amount of time, polls that have been conducted since March of whether Americans trust or have confidence in President Trump to handle the coronavirus pandemic or to share accurate information about it are relatively low. So our question is, what happens when Americans, voters, are exposed to both the president's interpretation or opinion or position on different points of uncertainty regarding this crisis, and they're also exposed to the CDC. As you see from Trump's press briefings, we've seen many times his opinions being proffered from the bully pulpit or from the podium that directly conflict with the experts that he has in the background. For instance, here's CDC Director Robert Redfield. So what happens? What happens when the president and CDC openly disagree on these important topics related to the crisis? So to test this, what we did is in a survey, we asked over 1,000 US voters to make their best estimate on 3 points, 3 really salient points of uncertainty regarding the COVID-19 crisis. So 1, what is the case fatality rate of COVID-19? So another is, how long do you think it'll be until a vaccine's developed? And third, how important is it to wear a mask in public to prevent the spread of the virus itself? So each subject, that is voter, was first given very basic information about each of these uncertainties so that we can make sure that they had at least some informed opinion. And then they were asked to give their best guess. So for instance, they were given this sliding scale, right? And they were asked, you know, if you had to guess what percentage of those infected with the virus would likely die, that is the case fatality rate, what would it be? And they could slide this back and forth until they came to what they think their best estimate would be, between 0 to 20%, right? And then we asked if you had to guess on how many months. Again, they could slide between 0 and 24 months and make their best guess, right? Finally, on a scale to 1 to 10, with 1 standing for not important at all and 10 for extremely important, how important is it that people wear a mask to prevent the spread of the novel coronavirus? Now, this is measuring their priors before they're, you know, in this particular experiment, exposed to positions proffered by either the president or CDC. So then each subject, that is voter, were then randomly assigned to one of 2 groups. You were either assigned to the control group, and the control group in this sense was exposed to only Trump's stated position on the 3 topics. And then the quote unquote treatment group, those that were randomly assigned to the treatment group, they were exposed to both those the positions that the control group got about Trump and the stated position of the CDC on each of these topics. And as you can see, these positions differed, sometimes substantially. Trump's position on the case fatality rate, or CFR as I'll refer to it probably, is that, you know, he thought that it's going to eventually be much lower than 1%. It turns out, I think that he's going to be fairly correct on that assessment, at least from the data that we've collected so far. Whereas the CDC's position on this was that it would be as high as 3% in terms of case fatality rate, with a lower bar of 2%. But this is how we presented the information as proffered by the CDC. Then, in terms of when a vaccine would be ready, Trump is quoted from his press briefings as saying that it would be developed in just a few months, whereas CDC's position of when a vaccine might be ready was anywhere from 12 to 18 months to develop a vaccine. You can see these disparities between the two positions, especially in the vaccine, and also in terms of the importance of masks, where President Trump said wearing a mask is a voluntary thing and that he's choosing not to do it, whereas CDC is urging all Americans to wear a mask when they leave their homes. So, subjects after they were offered the same scales a second time. And then when we offered them the same scales that they had made a guess before they were introduced to this information, then they were asked if they would like to update those previous estimates. And then by doing so, we're able to capture the extent to which an explicit exposure to different information sources leads to updates in a direction that favors the CDC versus Trump or not, or the vice versa, whatever direction better aligns with a given source. So for the case fatality rate, this is a tough one, right? Because actually on average, both Republicans, Democrats, and as well independents tended to, or they had an average that was much higher in their initial guess than both the CDC estimate and the Trump estimate. So actually every update went in the negative after exposure, whether it's to Trump or to CDC. And there was really no statistical difference with these groups. That is, if you were in the treatment group that was exposed to both CDC and to Trump, there was really no statistical difference in how much you updated your prior according to that exposure. This little bar around, the little bar in the middle of each of these estimates basically is the confidence interval. That is within a 95% chance of another sample being around the same estimate as what we recorded. And so what we find is if these confidence intervals overlap, then we can't say with any confidence that there's a statistically significant difference between these two populations, that is the treatment population and the control population. However, things get a little different, right? So as you see here, there's no difference with the Democrats in terms of whether they were exposed to Trump only or they were exposed to both Trump and CDC. Statistically, these confidence intervals overlap. But when we get to the subject of vaccines, or we get to the subject of our third point of uncertainty, which is the importance of wearing a mask, we do start to see some real definitive differences in terms of both substance and statistically speaking, right? So here we see the Democrats are very much more likely to change in the direction of the CDC estimate. That is, they're likely to update their priors as much as a month and a half from their previous estimate, more towards the direction of the CDC, as opposed to those Democrats who are exposed only to information or to the position that Trump proffered in his daily briefings. But actually the same is true not just for Democrats, for independents, for Republicans. We see a definitive update in the direction of the CDC when exposed to that information. However, when only exposed to the information the president is offering, we see in the direction of the president or no kind of substantive difference between their first guess and their second estimate, right? And in terms of the importance of wearing a mask, from that from that 1 to 10 scale, again, we see that Americans, especially Democrats, and not so much independents, not so much Republicans, will up definitively in the direction of CDC. So what do we have here? We have an average change over the parties of looking towards CDC. We have general trust towards the CDC across the parties. However, we can tell with statistically significant differences between both Democrats and Republicans. If they're exposed to both CDC information and Trump, that they will update in terms of the importance of wearing a mask towards and towards the CDC's estimate as opposed to Trump. The takeaways from this first little study are that if there's inconsistency in institutional messaging, that it really matters. People are going to update their priors according to information to which they're exposed, but not all information sources are equal. On average, voters seem to update their priors on points of uncertainty about the crisis more towards the CDC than the president. But note, it's when they're exposed to the CDC's position. When they're exposed to only Trump, the likelihood is that they will not update their priors anywhere in terms of away from Trump, in terms of perhaps a disdain for Trump, or with an alignment with Trump, either way. So that brings up a second research agenda for us, which is we were focused on the brand equity that is associated with Trump, the Trump brand, so to speak. And so in this second piece, it's also co-authored with Tima Moldagaziev and John Marble, we test the associations that people have with the Trump administration's latest quote-unquote branding effort. So what we did is we provided over 1,000 US adults a picture of the public service announcement that was sent to every American household back in early March. And we outlined that postcard on the back side of it outlines the guidelines that are recommended by the CDC to slow the spread of the virus. That is, social distancing measures, washing one's hands, so on and so forth. So perhaps you've got this in the mail. It was sent to every household, but I know a lot of people just threw it out with a lot of junk mail. But maybe you recognize this card. And so what we did with this card is we asked respondents to click on the first thing that they notice. What do you first notice when you see this image? When you got this card in the mail, what was the first thing that you took notice of? By asking the respondents to click on the first thing, what we were doing is we were capturing the implicit association that people make with the purpose of the card. Now, President Trump was criticized, or the Trump administration was criticized for putting the president's name so prominently on the card. The Trump administration replied that that's a ridiculous criticism, and that they thought that it would help actually get uptake from the public in terms of those who at least thought the president was a nice guy, liked his general agenda, that having President Trump's name on the card would help uptake of these guidelines. At least that's the public position that they stated. We then asked a series of questions related to the crisis. And in particular, we asked subjects their relative approval of Trump's general job performance, as well as how he's performing in terms of handling the crisis. And so what we're doing in correlating their implicit associations with Trump's name to their assessments of the job, we can measure Trump's brand equity. Brand equity, by that we mean the value that derives from a consumer's perception of a brand name. So what we generated was this heat map. This is where all of our over 1,000 respondents had clicked for the first time. And we see that, ranking second behind the word coronavirus is the word Trump, and collectively President Trump. And so what we were interested in is how is, when someone clicks on President Trump, how is that associated with job approval? Generally speaking, and then also job approval handling the crisis. What we find is on average that those that clicked on President Trump, those that made an implicit association of the Trump quote unquote brand with that PSA had a far lower approval rating of Trump's performance generally on the job, and then also in terms of his handling of the crisis generally. Now, this is particularly important because Trump has further been criticized in terms of letting his name be associated with the stimulus checks. At first, there was rumors that every stimulus check would be signed by President Trump. That has moved to now that the letters that you receive associated with your stimulus check, a lot of people are getting direct deposits, that the letter that you receive associated with the stimulus check will still have President Trump's name prominently displayed within the letter. And so then we asked, okay, so for those respondents who have moderate to high anxiety in terms of their economic position based off of the crisis, how do they feel versus those that don't have high anxiety? And again, we found a statistically significant difference between those who clicked on President Trump and those who didn't. That is that we seem to find negative brand equity associated with President Trump by those who implicitly associate this PSA with the Trump brand, Trump name. But this is not true for Republicans. It is true, however, and this is problematic for President Trump's reelection campaign with independents. It's also true, of course, with Democrats. So the takeaway from this branding experiment is that in the eyes of both Democrats and independents, any implicit association of the PSA card to President Trump leads to more negative assessments of his job generally and in addressing the crisis. In other words, Trump's name appears to carry negative brand equity, and there's an implicit association of Trump's name to the PSA effort and perhaps otherwise in the future, the stimulus checks, and that this may lead to really bad effects, deleterious effects, a big word for bad, for his reelection campaign. And so finally, and this is really quickly because I know I have to wrap up, just a recent research effort that I'm involved with the Cynthia Barboza-Wilkes, who's a doctoral student here at the Price School, a fantastic doctoral student, by the way, where we did a diary method approach, and we followed 200 local government employees who filled out daily journal surveys for 3 weeks in the midst of the crisis. And what we wanted to know is that, among other topics, we asked these local public servants the extent to which any of the following political actors hindered or helped them in their jobs on a given day that they were filling out this diary. So over those 15 days times 200, so these 3,000 observations, we found that that in terms of Governor Newsom or the mayor of their local municipality tended to have rather high rankings in terms of how helpful they were in terms of these local public servants' day-to-day jobs. City council, significantly lower, at least statistically significantly lower, but the lowest was Trump on a national level. Now, it's just a mild indicator. We don't have a random sample there. So we followed these questions with diary entries that allowed us to collect a great deal of qualitative evidence on the daily obstacles and stresses that these public servants face in the front lines. And that data collection continues with exit interviews over the next 2 weeks. But here's some of their answers. Citizens approach them with confusion over messages they receive from the news, particularly news from Trump's briefings. There's an impression that city council members are exploiting the crisis as an opportunity to push tangential agendas, thereby wasting departmental resources towards those agendas. They have a lot of uncertainty over furloughs, cutbacks, and other economic uncertainties, including in their family, that induce stress and anxiety. And there's a lack of clarity on priorities during the crisis. Conflicting information leading to non-compliance of health directives on behalf of citizens, and that city and national politics is determining resource outlays, and new information from federal sources seems less reliable or timely than the actions at the local level. So in conclusion, overall, these 3 studies tell us that mixed messaging from political elites has real impacts on the ground. Citizens rely on political elites for information under crisis conditions, and it helps to have a positively balanced brand equity in order to gain people's confidence. In other words, how people perceive you going into this relationship is going to matter, and partisan identification does determine that in part. However, uncertainty leads to conflicting views that complicate citizens' perspectives and thereby complicate the jobs of those on the front lines. So with that, I hope some people are still around. I'm happy to answer some questions on any of these, and thank you for your time.
Hi, Bill. So yes, we have a couple of questions. The first one is from our Facebook Live. So those never tested or other fatalities from COVID-19 which were not initially tested are not counted, correct?
Oh, that is correct. There's still a ton of uncertainty over the case fatality rate. Now, the point of presenting these positions was, or for those 3 points of uncertainty, was indeed the very uncertainty surrounding them, right? And so case fatality rate is still an uncertain measurement. And so what we did is presented 2 estimates, one from the president and one from CDC. We're not claiming that either are absolutely correct.
And if you want to take down your screen so that people can see you responding, that'd be great.
Oh, sure. Sorry about that.
The next question is, what is your opinion of how the administration has handled COVID-19?
How the administration has handled. Well, I mean, that's I think one thing that we have to think about is the disaggregation of a very large federal service. So I personally don't believe that the president has handled this well in terms of coordinating a unified effort across federal government, or particularly across federal and state governments. However, parts of the federal government have been very effective in conveying information that improves public health against the onslaught, or the potential onslaught of the virus, right? And so that is actually evidenced in our first experiment. That is, when the CDC communicates, and when citizens effectively receive that communication, they update in the direction of the CDC.
Okay. And the next question is, why is the messaging between the CDC and Trump so different? Is it because of politics or personal interests or others?
So we did see that there was a difference in partisan identification, but then we saw within particularly the independents, and importantly within the Democrats, because remember, Trump took quite a few votes that were traditional kind of Democratic bases in the last election. So then in terms of whether or not partisan identification is driving everything, it seems to me, and evidenced by our experiment, that it's not just partisan identification, that it's a matter of the trustworthiness of the source, and that voters are looking at further dimensions than just partisan identification. They're looking at the integrity of the institution or individual that's conveying it. They're looking at the consistency of that message. And they're looking at the competence and expertise of the source.
Okay. The next question is, why are governments, federal, state, and local in the US so reluctant to mandate wearing masks as we see in Asia and elsewhere? Meanwhile, the same governments don't hesitate to shut down business and trash livelihoods and economies. It seems backwards and much more costly.
Was that a question? Why are they reluctant? Okay.
So reluctant to mandate wearing masks.
Yeah, so I mean, it's tough. People, a lot of this counters, the civil liberties that all of us are accustomed to, right? And what governments are asking people to do is to make some type of sacrifice of the individuals on behalf of the community, right? And many governments are run by people who have more kind of libertarian perspectives than that kind of communitarian perspective, so to speak, that might be, more called for during the times of the pandemic, right? You shouldn't disparage an individual's, unwillingness. It's more that they need the proper information necessary to make good decisions. Now, why a given government doesn't recommend something, I can't really speak to these individuals' motivations. All I can say is that it seems that the experts in this particular field recommend it kind of vociferously compared to those civil liberty concerns.
With your results in mind for the Trump CDC first study, do you think that there is messaging that might be helpful to expose stay-at-home protesters so that we may shift their views?
That's a question. I don't have an answer to that, but I will say that from both social psychology and political psychology, that there's a lot of effectiveness in particular frames in nudging behavior towards government ends, or not just government ends, but anyone from a marketing perspective can use to nudge behavior towards a preferred end on behalf of those that are sending the message. So I think that more careful and consistent attention to the frames that government actors are using might help.
Okay, the next question is, why not have a treatment group where respondents only have exposure to CDC information, one only have Trump exposure, and one have both, similar to some news briefings?
Yeah, that's a good question. I mean, that's somewhat a weakness of our study. However, at the same time, we did it based off of power analysis. So in order to have just one treatment versus another, you have to kind of think where would we meet a threshold of numbers that would, in theory, meet statistical significance if indeed there is a difference. That doesn't change the substance of the difference. All it means is that you need to to generalize this to a given population, that you need to have so many respondents in order to have more than one treatment group. Ours is limited because, frankly, it costs money to do these things. And so to have two treatment groups, we need to spend a lot more money. And so we didn't have the money.
Okay. And what kind of responses have you received from frontline workers that identified as Republican?
Yeah, so that's a great question, because I want to make it clear that while this was 200 local government workers in the Los Angeles area, we were really careful to try to make it as representative of both sides, both perspectives in terms of partisan identification. And so we had several people who identify as conservatives, who identify as Republicans, who were involved with this diary study. There was some support for President Trump in terms of his messaging, but it was very low, as you saw on the averages. And these averages were, I should say, balanced averages. And so they accommodate the fact of whether or not this person is a Republican or not a Republican. So it's a weighted average, so they say. And I should have pointed that out when I showed you.
Okay, great. Thank you so much, Bill. We really enjoyed this session. For those of you still on, this is recorded. We will be posting it live, as well as the slides from today. And we hope you'll join us next week for some additional price talks. Have a good rest of the day.
Thank you, Harley. And feel free to reach out if you have any further questions. My email is wresh@usc.edu. That's wresh@usc.edu. I'm happy to respond.